Hi, it's Dr. Van here. These days, if you sit an interview, you are likely to be asked questions about dealing with bullying. So, what is bullying? Bullying is unreasonable and inappropriate behavior. It is behavior that is repeated over time or in a recurring pattern, and it aims to intimidate, threaten, offend, degrade, insult, or humiliate. Examples include repeated hurtful remarks, attacks or abuse against the person, their family, or their work. Psychological harassment such as mind games, taunting, or deliberate exclusion. Intimidating, derogatory or abusive interactions. Assigning meaningless tasks for the purpose of embarrassing or undermining someone. Assigning tasks that are impossible for the person to complete, and deliberately changing work conditions to make it difficult for someone. Importantly, behaviors that are not considered bullying include giving people tasks that are part of their job description and performance managing people who are not performing their jobs to the required standard. Related to bullying are discrimination and harassment. Discrimination is treating someone less favorably due to personal characteristics such as age, gender, religious beliefs, political stance, marital status, pregnancy and family responsibilities, race, cultural background, and other identities. Harassment is a form of discrimination being unwanted, unwelcomed, or uninvited behavior that makes a person feel humiliated, intimidated, or offended. So, how will these negative behaviors of bullying, harassment, or discrimination likely come up in your interview? Well, there are two likely scenarios. 1. You experience these negative behaviors. What would you do? 2. You witness such negative behaviors. What would you do? The first scenario is likely to involve bullying, harassment, or discriminatory behavior being displayed against you by a peer or a senior colleague. There are a number of ways to address this issue. 1. Keep a documented record with examples of the unacceptable behavior being displayed. 2. Seek support from a peer, mentor, or senior colleague. Ask someone you trust to discuss the issues with the person displaying such unacceptable behavior. Sometimes, people do not understand that their behaviors are unacceptable and need to be educated. Ideally, the person you confide in should be at least on the same level of the workplace hierarchy as the person who needs to be educated on their behaviors. 3. If this does not resolve the issue, escalate the complaint to your manager, the head of department, or the director of medical services. If this still does not resolve the issue, you may make a formal complaint to the Human Resources Department, your training college such as the Royal Australian College of Surgeons, or an external agency such as the Fair Work Commission. Remember, you may choose to make an anonymous complaint, but organizations are less likely to act on anonymous complaints due to their anonymous nature. The second scenario will involve you witnessing or being informed of these negative behaviors experienced by your colleague. It is important to remember that you need to act on these situations because the official stance by the Australian hospitals and training colleges is that bullying, harassment, and discrimination are not to be tolerated. In this scenario, you are the confidant who needs to support those suffering. The actions to take depend on who is perpetrating the unacceptable behaviors. If the perpetrator is on the same or lower level of workplace hierarchy as you, then you should speak to that person. The conversation will involve identifying the unacceptable behavior, explaining why it is unacceptable, and detailing the escalation if the behavior continues. If the perpetrator is your senior colleague, it is best to refer the matter to another senior colleague for them to have that discussion. The power imbalance between you and the perpetrator may reduce the likelihood of success of any meaningful conversations. So in summary, bullying, harassment, and discrimination are not acceptable in the workplace. If you experience it or see someone else experience it, you should take the necessary steps of escalation to address it early. This is important at work and interviewing for your job. Thank you for watching. If you like this video, please like, subscribe, and comment for more videos.